My name is Ivana Maservi, and this is my psychiatric history interview for nr548.
My name is Quinlan Maservi, and I give my permission for this interview to be recorded and submitted to Chamberlain College of Nursing for grading purposes.
Hi, Quinlan. So, how old are you?
I am 19.
What brings you in today?
I've been feeling rather depressed
I see. How long has that been going on?
my entire life, but probably starting around 11 to 13.
Gotcha. And so, what brings you here on this particular visit?
I'm unsatisfied with my progress.
I see. Have you tried taking some medicines, or
I have not tried any medications.
have you gone to therapy or anything
I
like
have
that?
tried therapy.
Okay. And how long have you been doing that?
Probably 6 months or so.
Okay. Do you see any difference?
Yeah, it does help quite a bit, but
Okay.
I still feel it persisting.
Gotcha. All right. Well, let's see if we can help you out here. Do you have any allergies?
I do not have any allergies.
Okay. And I don't have your blood pressure and so on today, but our medical assistant will get that afterwards. All right. Do you take any medicines then other than prescription medications, over-the-counter medications, anything like that? None at all?
None.
Neither?
I take some Tylenol every now and then if I have a headache, but
Okay.
I don't frequently get headaches.
Any vitamins or supplements?
I do take multivitamins.
Multivitamins, and you take that daily?
Yeah, a daily multivitamin.
All right. Okay then. Well, I'm going to ask you a bunch of questions, and let's see. Have you been ever in a hospital with a psychiatric illness before?
Nope.
And have you had any visits to a psychiatrist before?
No, I've not.
So this is your first
Yes.
time? Okay, gotcha. But you say you've been depressed all your life?
That's how it feels.
Okay, gotcha. All right, well, and I am very curious about that in a little bit. Do you have any illnesses other than this current problem that you're facing?
No. No.
No?
No.
Any surgeries in the past?
I got my tonsils removed when I was like 10.
Oh, okay. All right, but nothing like diabetes or
Not that I'm aware of.
blood
no.
pressure problems, nothing like that. Okay, what about your family? Your mom, dad, brother, sister?
They're all in relatively good health. My dad has diabetes.
Oh, okay, gotcha. And he takes medicine for it?
Mhm.
All right, and about your like grandparents, how are they doing?
They're all dead.
Oh, I'm sorry to hear that.
Yeah.
And how did they, what did they pass away from?
One had a heart attack. The other, I think also heart attack, and then a liver failure, and I don't remember the last one.
Oh, okay, liver failure, that's, why, do you know why, or was that like a specific disease, or?
I am not sure.
Okay, all right.
Not
Okay, no worries. So that's what's happening there. Let me see. Have you had any childhood illnesses like asthma or like some where you had to be in isolation? Did you have COVID?
No, not in an impactful way. No.
Not in an impactful way, so you did have it?
I did have COVID, but it didn't like mess my life up per se.
Oh,
There
okay.
wasn't a large like change in my.
Okay, okay.
It
So you're.
It wasn't stressful
I see.
per se.
Were you vaccinated or?
Yeah, I was vaccinated.
Oh, okay. Okay, so it was like a lighter course.
Mhm.
Okay. So what do you do? Do you go to school? Do you work?
I go to school and I work.
Okay. All right. And where do you go to school?
The local state college.
Okay. And what are you studying?
Botany.
Okay. And since you've been feeling depressed and so on, is that somehow influenced how your studies are going?
Yeah, probably, but there is no reference point to compare to.
Oh, because you always feel
Yes.
this way?
Yeah.
All right. And what do you do for work?
I work in the back of a restaurant.
Gotcha. Any problems with work or with your coworkers, boss?
No, they're all lovely people,
Okay. Okay. So no problems there.
generally.
Okay. Gotcha. And um, all right. Well, I guess let's move on to what do you do in your spare time?
I like to read. I am trying to get better at writing, and I also whittle and I'm trying to draw. And I also watch an insane amount of YouTube.
I see. I see. And since you have been depressed, you saying, has it somehow influenced how you can concentrate? Are you able to read a book? Are you able to watch your shows like you?
It stops me from keeping interest in things, I feel.
Mm-hmm, mm-hmm. So when did that interest you think kind of died off, or are you still interested but just less than normal, or are you like not able to focus, or what's?
I think I am interested as much as I was before, but I feel, I don't know, an inability to care about the pursuit. I
Gotcha.
guess. But like I want to do it.
Uh-huh.
I don't know.
I see. Are you suffering from fatigue?
Probably a little bit.
Mm-hmm. Any problems with sleep?
Yeah, I don't get the greatest sleep. I'm a little bit of an insomniac.
Uh-huh. So are you waking up early or are you not able to fall asleep?
Generally, I have problems with falling asleep.
Okay. And when you fall asleep, you sleep how many hours at night, do you think?
Probably somewhere between 7 and 9.
Okay. So
A
not
good
too
amount.
bad, I
Yeah, a
guess.
good amount of sleep.
Do you have any problems with like weight gain, weight loss, fever, chills, some weakness in your limbs, balance problems, anything like that?
No.
Like
No.
when you walk, are you feeling
No.
dizzy or
No,
falling
no, I
over,
feel
anything
fine.
like that?
Yeah, no.
Any night sweats?
No, and occasionally I'll wake up sweaty, but it might just be because I was covered
Oh,
too
okay.
much. Like, with a
Any
blanket.
problems with your skin, like rashes or
No.
any wounds, anything like that? Okay, now I'm gonna move on to like your senses. Do you have any problems with your vision? Do you wear glasses?
I should probably get glasses at some point.
But do you have any double vision?
No.
Any like blurred vision? Is the light bothering you? Do you have any like sensitivity to light?
Maybe harsh artificial light.
Okay, but nothing like different from previously?
No.
All right, any earaches or ringing in the ears
No.
or changes in
No.
hearing? No, nothing like that. Okay. All right, and when it comes to your breathing, do you have any cough, any coughing of blood, or shortness of breath, wheezing, pain when you're breathing? Do you snore?
I don't snore.
Okay, all right, very good. All right, and then when it comes to like the headache, you said sometimes you have a headache. Do you have any numbness or tingling or lightheadedness? No,
No,
nothing like that.
no.
Any problems with your speech?
No. Not
Any
at all.
blurred speech? Or,
No, I don't
mean,
think so.
slurred speech or
What do you think?
It sounds good to me,
Sounds
but
good to you.
yeah.
I think it sounds good also.
All right. Any problems with your heart? Any chest pain?
No.
Have you ever had any problems with the heart that you know of?
No, not that I'm aware of.
All right. And do you suffer from any chronic pain? That would be like a back pain or leg pain or anything like that? No. Okay. I'm gonna move on to. Do you know if you ever had anemia or if you were ever told that or your parents?
No, I don't think I was.
Okay. And any problems with your stomach? Any nausea, vomiting, some irregular pattern of food?
No.
Do you get like 3 meals a day? You eat snacks, or do you just like eat?
I graze and sometimes I'll eat full meals, but generally I graze.
Okay, okay, all right. But no any binging or anything like that. Heartburn?
No.
Okay.
Sometimes if I eat something specifically, I can get heartburn. It's happened to me before.
Oh, okay. Like occasionally?
Yeah, occasionally.
Any problems swallowing?
No.
All right. And any problems with like going to the bathroom, urgency, frequency, or burning?
Mm-mm.
Okay. All right. And most likely you haven't heard of any thyroid problems in your life, have you?
I have not.
All right. Okay, Quinlan. Well, thank you. We'll proceed to the next part in a little while, and I'll have our helper to check your vital signs. Thank you.